Hello, hello. Welcome back.
Welcome.
Yeah, how's
Well,
it going?
welcome. I need to tell them welcome.
Welcome.
It's been a while.
This is Your Mental Health Matters. And what are we talking about today, Miss Tammy?
Well, first I say your mental health matters.
Yeah.
Sponsored by our Neutral Voices. And we thank you for your patience and this little break that we had. And today's topic is going to be a couple different things. One, anxiety, and then also touching a little bit on heart health and how that plays a part in mental health and well-being.
I was just excited to get into it. I was so excited to be back and get started.
Oh, yeah.
I
It's
forgot
been
we
a
had an
while.
intro. We supposed to say some stuff at first, right?
A little bit. bit.
But yeah, anxiety. I mean, broad topic. You know, there's a lot we could talk about with anxiety. I find, in just my experience, period, probably 40% of the people I saw struggle with some form of anxiety. So common forms of anxiety, what are we talking about?
So common forms, and I know that anxiety is like one of the main mental illnesses that's like on the documentation and paperwork. Couple main ones is generalized anxiety, which is described as exaggerated worry from everyday life experiences. Another one is PTSD, which is post-traumatic stress disorder, which can come from traumatic events like natural disasters, tragic deaths in families, and then also obsessive compulsive disorder, which is unwanted thoughts and rituals, which are kind of impossible to control for those individuals. So those were three main ones. And I believe, if our clients and those that are in the viewing area, if they want to look up more information about anxiety, you have a number of resources that we'll go over before we end this call.
Totally. Yeah.
Yep.
I always encourage people, I'm not the be all end all resource.
Right.
There's a lot of information out there about this stuff. But starting from the top, generalized anxiety disorder, how would you characterize that as far as, how it affects health?
How it affects health?
Heart health and all that stuff.
Okay, we can tie that into it a little bit. But some of the symptoms are being fatigued, headaches, tension, and some of those symptoms are kind of things that we think are general, everyday things that we're going through, stressors and what have you. But it says that if it goes on for 6 months, consistently, then you probably need to go get it diagnosed or go see your provider to get a better diagnosis of what's going on so they can better help you and move on with quote unquote normal life for you.
Is that something you think, does it normally require medication? I feel like a lot of people seek medication for generalized anxiety disorder.
However, I know most therapists would rather you try other remedies and coping skills before medication. We're not saying don't try medication, but there are some things we can do, like changing our lifestyles with what we're eating, our nutrition, sleep habits, getting enough sleep, getting quality sleep, not just quantity sleep. Exercise is definitely one. Those are some natural things that we can do.
Which could be said for all
forms
of us. Of anxiety too.
That's right. And support groups, therapy. However, when it gets to like supplements and medication, you do want to seek your provider, your doctor,
always
before you start taking anything.
Even if it's over the counter, even if it's all natural, you don't know how you might react
to it, because everybody doesn't react the same way.
Yeah, totally.
So
I also find that, some type of, and this again goes for a lot of things, some type of mindfulness activity, whether that's,
meditation,
yoga,
imaging,
progressive muscle relaxation.
Oh yeah.
There's lots of different, guided meditation. There's apps. There's all kind of stuff. That
I don't know if a lot of people know about the progressive
muscle relaxation.
muscle relaxation.
Yeah,
Yes,
yeah.
I've tried that, and that's something you can do, at your desk,
Yeah.
in privacy of your own home. You don't need any gadgets or anything. That's another thing I wanted to add to that. Sometimes our computers and phones can cause extra anxiety,
Yeah.
and I don't think we give ourselves enough time to break from that, to take a serious break from the screen time.
Yeah, yeah. And
Because
be mindful about it.
Right.
If the
Because
first thing you do in the morning is get on there and you
get on
scroll
there.
through horrible, tragic news
Right.
first thing in the morning when
You're
your brain's
anxious.
all receptive.
Right.
Yeah, that's not.
And then if that's what you use to go to bed, then your brain is constantly going.
Yeah.
So we need to take those things into consideration and minimize it. And we can probably start seeing changes without having to go to medication. But again, if it's going on for 6 months and it's being problemsome for your work and everyday life, then yes, you do need to go seek professional help.
Yeah. And I feel like it doesn't have to be a chore to add mindfulness strategies and these different things into your life. It could be something small to start that you
Right.
kind of build on.
Right.
Like again, we talked about the meditation or the progressive muscle relaxation. That's something you can do in your car for 2 to 5 minutes when you pull up in the parking lot at work.
Right.
Taking that second to breathe and transition to that next zone.
The deep breathing.
The deep breathing. Yes.
Yeah.
Yeah.
They call it that diaphragmic breathing, and really relax and get your mind kind of cleared up and ready to go.
Which I
Yeah.
guess we're jumping into treatment already, but again,
No, yeah.
it applies.
Well,
It applies.
sometimes it is, simple remedies.
Yes.
Simple remedies that
Simpler
we
the
can do.
better.
Yeah,
Keep it simple.
that's right.
So what was the next one we had? The OCD, was it? We talked about
Obsessive compulsive disorder.
OCD? Yeah.
Yes, and that's unwanted thoughts and rituals that are sometimes impossible to control for individuals. So
And I think what I always like to point out, is the obsessions and compulsions. Like I've had people say, "Oh, I got OCD. I like my house clean." That's not OCD. You know what I'm saying? Just because you like your house clean, that's not OCD. There's obsessions and compulsions that come with it, and people know they're irrational. They know they don't make sense, and like you said, it's almost impossible for them to control those habits.
right.
So the example I often use is like checking your oven 15
Constantly.
times before you leave the house to make sure it's off, so you don't burn your house down. Right? You check it 15 times. Now you're late to work, and now you're 10 minutes into your drive on your way to work, and you turn around and go home and check the oven again,
Wow.
even though you haven't turned it on in 3 months.
Wow.
You know it's not rational, and I think that creates that anxiety, that downward spiral of anxiety, because then it becomes that kind of like a soothing mechanism, to
And
fall
you're
into
just
those patterns.
focused on that thing, like constantly. Yeah.
So yeah, and I like to distinguish that, is there are, I think, things that may be anxiety inducing for people, that things being out of order or out of place, but I also feel like OCD is different. You know what I mean? So yeah, it's a little more severe as far as the obsessions and compulsions go,
Right.
like, in my experience. So
Yep. That's good. And then for you, what have you recommended for treatment or remedies to cope with OCD?
again, I always go back to most research shows that some form of cognitive behavior therapy, along with medication, tends to be the most effective treatment. And again, it's best when the doctors are on board and they're communicating with the therapists, and that's going on.
Right.
I also find that again, having some type of proactive strategy, instead of just waiting for it to hit, it's coming. So having ways I've said this before, it's like everybody's got their cup, and that cup's going to fill up and overflow with stress in life. So
Right.
you got to learn how to pour that cup out before it overflows. And I
Right.
think that's part of, with OCD, is being able to,
Lifestyle, definitely, but managing what we do. Yeah.
and having those things in your routine that are things that help you relax, things that are mindfulness exercises, again, self-care, seeing a therapist, seeing a doctor. And sure, I can admit that it can be uncomfortable, But I gotta reiterate to people, your therapist isn't there to judge you.
Right.
They're there to help you problem solve, to help you
Right.
figure this out. And just like your doctor's not there to judge you. They're to help diagnose you accurately
way.
so you can
Yeah.
get the right treatment.
And not you
And they
just
can't do that
self-diagnosing.
if you're not being honest.
Right.
And so
Yep.
yeah.
That's good. So we will. You done with that one?
Yeah,
Okay.
I think I'm
So the PTSD, that's a big one, and I know at some point we're gonna not on this episode, but I know at some point we're wanting to dive deeper into that, especially when it comes to the children. But that's been a big topic and a big diagnosis here in society lately,
agreed.
and it doesn't have to be like a direct incident or action against you. Personally,
Right.
it could be something
very
that
true.
happened in the neighborhood. Like we've had these episodes with the airplanes. That can be something that triggers post traumatic
Sure.
stress disorder.
Sure.
And what I found interesting is the research that's on the children with PTSD just from neighborhood like violence, crimes, and all that. And they say that a lot of children can't, I guess, get over it like a soldier would that's in war.
Yeah.
And because they're constantly thinking about it,
I would
and
agree
then
with
they
that.
can't leave the environment.
Yeah, they
you know,
don't
that
have
they're
the
in.
they don't have
right.
the access like adults have.
Right.
Yeah.
Right. So
I mean, even the coping skills, like an adult can go to the bar and get hammered. Not saying that's a good thing, but a kid can't do that.
No.
He can go drink his sorrows away. Not advising that, but I'm just saying,
Right.
the kid still has less access and less coping skills.
less
to the
coping
developed
skills.
Adult.
Right.
Yeah.
And a lot of times it's not recognized in kids. Sometimes they're acting out in different ways, and adults are being I guess punitive toward them without knowing, it's deeper than what you see as far as their behavior. And sometimes they need to investigate those things. What have children seen, even as young as 4 and 5 years old? You can't just dismiss some of their behavior and not say it's not related
True.
to some of the trauma,
reaction.
even death in their families. They don't know how to process that.
Yeah.
And we need to take our time to help them get through it the best way we know how, but then also getting those resources from the therapists, from the doctors and what have you.
Totally. And, again, I think we're still as a society really understanding the breadth of PTSD,
Yep.
and you hear these terms like generational trauma and stuff like that.
Oh, yeah.
And, these things are being more explored now than they were 10, 20 years ago.
Right.
I'd also like to point out too, I don't feel like I know, there's a difference between like PTSD and like there are other traumatic responses.
Right.
So there's acute stress disorder. There's adjustment disorder, which can come with
Grief.
different types of depression, mood disorder, mood disturbance as well, behavioral issues as well. So just because someone does experience trauma doesn't necessarily mean it's post-traumatic stress disorder.
Right. And there is a time frame for that one too. Like
Yep.
I think it's like 3 months after the event and you're still having like nightmares, flashbacks, yep. And
Panic attacks,
anger,
yeah.
irritability
Yeah.
is also a symptom of that. And a lot of people wouldn't think so, So that's pretty interesting and a lot of information to dive into.
It is. We could spend a whole show.
Oh, yeah,
several
just on
shows
that one.
on PTSD.
Just
Yeah,
on that
straight
one.
up.
Yep. And what was our third one? Oh, we did the general anxiety already. So treatment will reiterate those things. If you want to go as far as natural, again, the exercise, the nutrition, the sleep, those are the 3 main things that we can do. And then therapy under the doctor's care.
Yeah, that's a strong component of it is, understanding those anxious thoughts, that excessive worry and where it comes from and what triggers it and stuff like that.
Right.
And I feel like it's hard to understand it if you're not asking the questions and if you're not going to the experts to really
Right.
find it out. And I feel like anxiety to me, in the way I treated it, it's like kind of 2 components. It's your body's reaction to anxiety, right? Anxious thoughts, whatever, the issue is. But then there's also how we perceive the anxious thoughts and feelings.
Right.
And I think that's the harder part to turn off. You know what I mean? Because you could take a bunch of Xanax and not have the feelings. You know what I mean? But the thoughts, so to handle the
going.
thoughts, I feel that's where that therapy comes in. That's where, journaling,
Right.
stuff like that.
That's a good one too.
Yeah.
Didn't mention that. And inexpensive.
Yeah,
Something
right.
they can do. Yeah.
Free.
Yeah.
Yeah.
Well, not free because you got to buy a notebook, right?
True.
Yeah. Okay.
You can write on the wall. No, don't write on the walls. Don't do that.
Yeah. And yoga was another one. I don't like yoga, but that was one of
You
them.
like
yeah.
yoga?
No,
Yeah. And I feel like I will say this. You don't have to be a yoga master, a yogi.
Right.
There are levels of yoga. And I feel like nowadays there's so many YouTube videos you can go to like, easy yoga for beginners.
Right.
Yoga for headaches, yoga for relaxation, yoga for sleep. There's so many types.
And you say that you don't have to be an expert in that. And a lot of people tend to think they have to be athletes to get into a good exercise program, and that's not true. And that's a misconception, and probably why a lot of us are dealing with different illnesses and things, because we think that we have to be a stellar athlete to get involved.
Yeah. All the conditions must be perfect.
Yeah.
You know what I mean?
Anxiety.
Yeah.
That's anxiety.
Yeah. There's no perfect time to start.
Right.
You know what I mean?
Self-care, that's
just start.
overall self-care.
Yes.
What we've talked about.
And I think it's so huge to take time out of your day to do something for yourself.
Right.
You know what I mean? It's not selfish.
Right.
If anything, it's selfless. It allows you to be able to do those other things
For other people.
Exactly.
Right. And I recommend, in the morning before everything gets started, the hectic part of the day. And then also at the end of the day.
Yeah.
Take 5 or 10 minutes for yourself and just be.
I just thought of this. It's funny we were talking about this. I worked with a guy who, had some anxiety, panic attacks and stuff. And he was prescribed medication for a while and just didn't want to take medication for it.
Right.
But for about a year, he had this medication, and it was more as needed. If he had an anxiety attack, he could take it. But he actually started doing a guided meditation yoga video first thing in the morning when he woke up. And he said what it did was he noticed that before he would wake up and immediately his anxiety would start to build throughout the day, thinking about what I got to do, where I got to go, all this. But when he started with that guided meditation yoga video, and it was just like a 5-10 minute YouTube thing, it brought his anxiety down. And so he started off his day with his anxiety going on a decline. And so it never really got up, and they took him off the medication. So, and I know that's just one experience, one example, but I mean, I know there's been people that have benefited from doing something like that first thing in the morning before those thoughts hit, and they start their day and start building up all this stress.
Right.
So, yeah.
That's good. That's good. Anything else on anxiety?
Yeah.
I think those were kind of the main ones. However, there are resources, the Mental Health America, and then also the Centers of Disease Control. They do also have resources on their websites. Again, that's Mental Health America and Center for Disease Control. And we'll reiterate that before the show is over with.
Yeah. Nice.
So, any other resources that you can think of?
Not offhand. Not specifically for anxiety, but I still say you can always start with your doctor, your pediatrician, your primary care physician, to get just start asking those questions. Even if you're not seeking a diagnosis, even if you're not seeking medication, I think it's good to start asking those questions if it's a concern when it comes to anxiety. And also, we've been talking about how it affects your health. So once again, if you're having heart issues, and
then you put anxiety with that.
It's even more important.
Or anxiety causing some of those heart issues, because that's a part of stress. And that's what we're going to touch a little bit on as well, because February is Heart Health Awareness Month.
Right on.
And many of you know, and most of us know, that heart disease is the number one killer for men and women in the United States of America. So we do have to just remind ourselves to do better and take better care of our hearts, because not just with the heart disease, like we said, with the anxiety can trigger physical ailments, as well as having a heart condition can trigger anxiety and mental disorders. And we've touched on that, the chronic stress. That's one of the main ones, I think, too, because we deal with that like on a daily basis.
I agree,
just from whether it's family life, the kids,
Media.
work, media.
Work, yeah.
Oh my gosh, the
Traffic.
news. Oh my gosh.
Yeah.
And then we're going to go a step further with racial trauma.
Yeah.
No one wants to talk about that too much these days, but it's a thing.
It's a thing. Sure,
It's a thing. Yeah. And just having to move in the world when certain situations are happening, and we just need to know how to do that in a healthy way, coping way.
And it's just, again, I reiterate, so much of it is preventable. It's so much of it is preventable. Sure, there's genetic things, there are defects and stuff like that, but I feel rare. And I've even seen people with, heart issues still be able to exercise, still be able to do things to manage it.
Right.
Or again, going back to like diabetes, I've seen people with exercise, diet, be able to manage their diabetes without insulin and without medication in certain situations. So again, just so much of it is preventable. And why wait? That's why I go back to it's a new year. Why wait?
Why wait?
You know what I'm
start
saying?
Now.
Yeah, right now.
So
why not?
One of the number one things that can prevent heart disease is not smoking. That's one of the main things. And I do know that a lot of people tend to deal with their mental health issues and stress by smoking.
Self-medication.
Which is going to trigger some things with your heart, whether it's increasing your blood pressure, increasing your heart rate, and so on. And then that triggers other things.
Is that the same with as far as vaping too?
It is, but
Does it have similar impacts on your heart health?
I think vaping is going to be a little bit more. We don't know the total effects of that right now.
Because it hasn't been around as long as tobacco. But
But you have to think about vaping is a battery-operated instrument, and it has a lot more chemicals produced once that battery is on. Whereas, we know most of the effects from cigarette and tobacco smoking. However, vaping has just gotten on the scene in the last, 10 years or so. And we don't know the magnitude of that yet.
True.
However, we've seen a lot. Like one of the main things is that popcorn lung condition. And it's devastating because it's impacting a lot of the young people.
Oh, yeah.
And vaping is geared toward young people getting it,
That's who they're
right?
targeting.
Because they're more impressionable than most. However, I encourage people to do your research on all of it.
True.
Just because it's a new thing, it's cute, and it can give you different flavors and what have you, doesn't mean that it's good for you.
It's good.
No, and I don't recommend that as being a substitute to smoking, because it's just as bad, if not worse. Yeah.
I find it too. It's with smoking. Like if you're a smoker, you got to wait to take a smoke break. You know what I mean? So you're not just smoking all day long in most cases. But it's like, I feel like with the vapes, man, people just have them all just everywhere they go. Kids vaping in school.
And
I've
they
heard of
do
kids
it on the
vaping
slide. In the classroom, because they do it on the slide. And I think initially they used to look like the USB ports, and they would have their hands covered on it, and when the teachers look in the opposite way, they just take their puff or what have you.
Right, and it smells like strawberries,
right?
Teddy Grahams.
Yeah.
So
that's the danger of it, is because it's impacting our kids. Number one,
and they're developing bodies too.
Right.
You know what I mean?
Right. And the industry knows what it's doing, because most times when we try to correct the kid and say, oh, no, that's not right, they're not listening to us anyway. They just want to do what's cool or perceived as cool, or whatever the term is nowadays. I don't know if that's it.
I might be getting old.
Oh, okay. I got to get the new terms.
Yeah, the new lingo.
But unfortunately, it is catered to them, and they're the biggest category that are
It would
using
make me
it.
mad just knowing I'm being targeted. Like they're like, "Hey, you," you know what I'm saying?
Right.
Come here.
But think
Hey,
about
kid.
it.
You
They're
know
the
what I'm saying?
most impressionable.
Yeah.
And they're at a time, especially the teenagers, they're at a time where they're trying to pull away from the rules and regulations of mom and
Push
dad.
their boundaries a bit.
Yeah, you
I
can't
get
tell
it.
me.
And again, I was an idiot when I was.
Well,
I was an idiot.
I wouldn't say idiot.
I was
no.
dumb.
I
But
think we
again, you live and learn, right?
we live and learn,
Yeah.
but we still the best that we can do and the most that we can do, I think, is still educate them.
True.
As often as we can, even when it seems like they're not listening and don't want to hear us. keep pushing the information to them.
And to educate them, you got to educate yourself.
That's
you know
true.
You just be filling
Moms
them with
and
some
dads
nonsense.
and uncles and aunts.
Yeah.
Yeah. Educate yourself to be better prepared to educate the young ones, because just because it looks good, tastes good, doesn't mean it's good for you. And that's a trickle down effect. If you're using those things to cope with your stress, anxiety and mental health, it can trigger other things, physical, like your heart health.
Totally. And
Yeah.
again, I go back to why add to the problem. If
Right.
you're already dealing with anxiety, some health issues, why add to it with more?
You're
So,
definitely doing that. Yeah. So some other connections between mental health disorders, and I think we mentioned before, starting off with a mental health disorder can trigger some of the heart disease in itself, by some of the psychotropic medications.
It's true.
And that's why it's important to read up on whatever
Side effects,
prescriptions that you're prescribed from your provider, to know what to expect and not be surprised by a lot of things.
Yeah. A lot of times they get you meds to deal with the side effects of the other meds. Yeah.
And that's unfortunate. And it seems like it's just a revolving door, and we have to just be informed.
I get it in the sense, people are suffering, and they need some relief, and they go and they say, hey, I'm having this problem, and someone gives them medication for it. But I go back to, if you don't make those lifestyle changes, no pill's going to fix it.
No. And that's one thing I think, as a whole, we need to get a grasp on.
Yeah.
Because a pill, a drink, a cigarette, a device is not going to solve those issues if you don't sit down and deal with them. Yeah. It's just going to contribute to what's already there.
And what's the saying? If nothing changes, nothing changes.
Right. It
You know
won't
what I'm
change.
saying? Yeah.
Yeah.
So, definitely. Nice. Good talk.
Yeah.
So any other resources or anything as far as
resources? Some of the heart disease, of course, the American Heart Association, I think, is heart.org for them. And they definitely have a lot of resources on heart health and what we can do in reference to treating our heart health and mental health, as a combination. What else? Reducing our risk, find appropriate services and support groups to increase healthier behaviors, recognizing our signs and symptoms, knowing our family history.
That's a big
and
one too.
Where we fit in there, like the immediate family, mom, dad, first line siblings, and what have you. Know that. And then also preventative measures. We can't say that enough.
Yeah. And just kind of a side note, maybe a random thought, but I encourage everybody as well to get CPR and first aid certified.
Oh my gosh.
You know what I'm
yes,
saying?
because
chances are, if someone has a heart issue, health issue, the person you're performing CPR on may be a family member.
Right.
You know what I mean? And that may be what keeps them alive and in your life.
Right.
So
you mentioned that. I know we only have a couple minutes left. A lot of people get heart attack or cardiac arrest. They get those confused, whereas the cardiac arrest is more of an electrical issue going on in your body, and that can be sudden death.
Gotcha.
Whereas heart attack is more of a circulation problem. And some of those things with the heart attack, with circulation, those can be preventative measures like what we're eating, exercise, moving your body, not sitting so much. It's recommended that if you sit most of the day, get up every hour on the hour and move for maybe 5 minutes, just to keep, the juices flowing, so to speak. Yeah.
Walk. It's free.
Walking is free. Just get a good pair of gym shoes.
Good shoes,
Yeah,
man. So. And again, I know we don't have a lot of time, but I think diet. I think I cannot overstate diet.
Right.
Green
leafy vegetables. That's the first thing that comes to mind. I don't eat them all the time. However,
but
everything in moderation.
Yep.
Get used to it. Put more of the
whole foods, non-processed foods, whole grains,
water.
lean proteins. Staying away from Fast food. Again, I know it's convenient.
Processed food.
But
Oh my gosh.
Yeah.
We'll have to have a whole topic on that one day.
We really can. Because again, I go back to that. It affects people's health, which is going to affect their mood, which is going to affect their sleep, which is going to their social interactions.
Exactly.
And
yeah, that's a big one with the processed food, with the increased sugars and salts, and that's really killing us.
Yeah.
Killing us slowly.
And again, if you're already struggling with depression and, you put on 60 pounds over the winter, you feel me? And now it's even harder on your body to move around, and it's even easier to fall down, sink down into that hole. So yeah, that's what I keep saying it. Start now, get up, better move.
It's a great time to start.
I'm telling you, use it or lose it. No.
Right.
Yeah. Well, good stuff.
All right. Was good being back.
Yes. Happy New Year.
And Happy New Year to you too. We're almost in
February.
But it's been
That's
good.
all right. Yeah.
It's a good break,
It's gonna be
but
a good year.
it's good to be back as well.
Yeah, I'm excited.
Yeah.
Is that it? Okay. Wow. You still recording? Well, hey, take care of yourselves. Protect your mind. Your mental health matters.
Thank you for joining us. Peace.